you get the gist of what I'm trying to say. So
It's not gonna kill you.
it's not going to kill you. They cleared the unit. So the companies that, before they get approved for their machine, they submit it to the FDA and they look at their studies to show what they did, and then they approve that particular unit. And each of these companies get their approval for that. So whenever you're looking for a laser, ask them which ones have already been approved by the FDA. Because it might be a new company that's out there that hasn't gone through that process, and so you want to know that at least what they're saying is true and documented. So Arconia is one of the more well-known laser companies. They're kind of like foot levelers and standard process within our profession. They give a lot to chiropractic. There's 3 brothers that run Arconia. They're up in, they used to be in the this coast, maybe like Virginia, somewhere in that area. Then they moved to Texas, in the Dallas area, and now they're actually they're in Florida, and they're up in Melbourne. Actually, I think Melbourne is where their corporation is at. So if you ever have a chance to go to one of their seminars, they're a good company. Hopefully I'll have one of the 3 brothers that own this, the Shanks brothers, S-H-A-N-K-S. Charlie Shank is the one I talk with, but anyway, they're 3 brothers that do the Arconia laser, and they're very chiro friendly. None of them are chiropractors, they just do that. Just like with standard process foot levelers, all the owners aren't chiropractors, they just do a lot in chiropractic profession. So anyway, so this one is a A2, this one's expensive. They have some that are handheld within Arconia. This is kind of a little simple handheld one. These are $6,000, $7,000 each. This is through Avant laser.
And this is 37?
This one. Right. They have different levels, different types of lasers, all those kinds of stuff. So if you're thinking about, obviously there's finance in that area. Chiropractors that do lasers are more in sports or injury related type. Lasers aren't covered much by insurance, so chances are these will be your cash patients paying these. They obviously get people better because people keep coming back and doctors are buying these units. So if it wasn't cost effective and insurance wasn't paying, then they would have thought, well, it's not really cost effective.
What's a treatment like that cost, just out of curiosity?
You're probably looking at about $50, $75.
Per visit, and a visit is how long?
Depends on the modality. These particular ones here go into a different. The cool thing with the companies is they kind of give you little simple sheets. So this would be like a hip pain area. You kind of pass that around and kind of look at each of them. So they have their own diagrams of how the areas you would put it on. So you don't really have to think much. Arconia has a little image on here of where to set it on the patient, and you just turn it on. The nice thing about this particular unit is I could have obviously only one of them at a time, but I could put this on, put it on the patient, and then walk out the room. These you have to hold on the patient. But you're only doing it for 30 seconds at a time, 60 seconds at a time per minute, so it's not that lengthy of a particular period. So let's do a little here. So the patient's laying down here, and we'll do this on somebody in a few seconds here.
Yeah, we got it.
So the way, yes. This one, no. This one, possibly. 4s, definitely. So if you have ink, which a lot of people do, be a little more cautious when you start getting into 3D. That's another reason why the 2 would be a little bit better, because they're not going to have any fading or running or bleeding of the tattoo with this particular unit. The class 2, you don't need to wear a goggle, but I would encourage you to always wear goggles. This one has 2 there, 2 there. There's always haters.
You got to put them on.
I put them on.
Yes, sir.
Roll my glasses. Because people don't know what kind of lasers this is.
That's right.
And they're gonna say, Dr. Haley, I saw her and she was doing all this laser and all these people and I didn't see one goggle on anybody. Aren't you supposed to wear goggles when lasers? Yeah. But not with a tube. You don't need to. So that's why I always wear the lasers, even not just so you get on good. These for sure you need to do. The class 3B lasers and up, you have to register with the state of Florida or whatever state you go into. It is I don't have the little radiation sticker, but the radiation stickers should be posted so people know when you're using that, so you can keep it on the door, whatever treatment room that you're using, if we're going to be using these particular type of lasers. Right? So we have the goggles on. And the nice thing with the approved ones, that laser has it already preset in there. And so when you kind of look over this, I'll let you kind of glance over, oops. Heel pain, neck, shoulder, low back, post-op, head, cerebellum, I'll explain that to you in a little bit. Neck and shoulder. Anyway, so when Arconia went and got theirs approved, they did the classic chiropractic ones. So that's a good thing. So you don't even have to think, they already have their approved ones. And so that's why we have these approved. And so I would encourage you. Now, when you look on this other homepage, it's a touchscreen, the user protocols, it has for disc herniation, bursitis, edema, scar tissue, ligament, tendonitis. Those aren't yet approved yet. But they have their studies and logged in, this is what they would use for those particular ones. So you'll see both sides, the quick preset protocols, those are the ones that are FDA approved. So in this case, we can do low back pain. And you're gonna come over here and you look at this in a second. Hello. There you go. Okay. And so when you kind of see this picture, it kind of has a drawing of how the patient is there. I'm just gonna put this down. Imagine the patient lying down, face down. This is in their low back region. We have our goggles on. This will be a preset 20 minutes for that. And so you may think, well, can I change the settings? Yeah, you use the doctor, you can do whatever you want. But the 20 is what they've cleared through the FDA, so that's their standard protocol that they have put. So just keep that as we go through. And all you're gonna do is set that up, and we're gonna set this up on somebody in a little bit, and you have your 3. So how far do you need to be from the patient? You can be close to about 1 inch away from them. You don't have to be too far. This one has 3 beams kind of in that region. Those of you that do acupuncture, Arconia's does pretty good because of the multiple. You can kind of position these into little acupressure puncture regions if you wanted to, and stimulate
Pretty cool.
Those particular areas.
Does someone have the red and the purple light on it, or just the red?
Just right.
The red.
Right. So that's this particular.
And that gets hot.
No. So this is a cold laser. So this will be our low-level lasers. Low-level laser there. Huh?
That's a 2.
This is 2, class 2. On Wednesday, we'll go over the different classes to separate. This one's 39,000. For that, I'm sure they'll give you a deal for 34,000. But you never know. I'll have the company come out at some point, or you have contact for them, or if you get in the habit of start going to like the FCA conventions, they're usually always there, and talk to them, tell you're a student. The nice thing about going to the conventions is a lot of these laser companies give away free, and so throw your name in there, you might get a drawing if you're lucky. Every time I've gone, students have actually won, not from here, but other chiropractic colleges. So you never know, you'd be lucky enough just to walk by the booth. Huh? Overdue, it's time. It's time for somebody to put their name in there to do
I
that.
gotta represent.
So when you're going to buy a laser, how do you decide which is best for you?
Good question, that's the $1 million question. Because they're gonna sell you everything. Like this particular unit here, when we look at frequencies, you're pretty much gonna be between the 600 to 1,000 nanometer range in there. So which one's the most therapeutic? Orconia is gonna say 600, 682, 685. This one is like 6 something, 8 something. So they have their magic number. And they vary from company to company. And so they'll have to explain that to you, which one is better. But as long as it's in that 600 to 1,000 nanometer range, then you know you're kind of in a good quality range. If they tell you they're, $599, don't even look at that. It needs to be 600 to I'll show you a little graph on Wednesday that kind of explains that particular area. So this one's kind of cool. So here. And a second, you'll see this little beep. I'll just shine this to the wall because I don't have my goggles on. So this one you want to do. So some of you that have tattoos, be a little cautious with this particular one. Don't do it directly over it. This one, if you have a tattoo, is not going to work. It's go laser. Even though class 3B can be considered a cold laser, you definitely still need to wear the goggles because it can still affect the retina in that one. This one here still could, but it's a different class, so you're not going to get that heat area. The class 4 lasers, definitely that could burn you. You need to wear goggles with that one. That's when you get more surgical grade or the class 4s. So a lot of people think, well, if I'm going to get a laser, I might as well get the best one. Let me get a class 4.
That's right.
And that's okay. You can do it. There's some really good lasers that are class 4. Less time, just know that there's a little more risk, and you can have your precautions with that. So as you click on each one of these buttons, they kind of have, and you'll look at this in a second, it'll have chronic pain, acute pain, it'll have for muscle spasm, it'll have different settings on there. Most of the time we use this as some type of pain, and so pain is considered a modality for healing. And so it really doesn't matter the setting you have in it, it's all going to do pretty much the same part. So as you look at this little diagram over here where it has for muscle balance or pain, pretty much we're going to give you the same types. And they'll give you these particular little binders of their own protocols as they go for that. I'm not sure exactly what Avant laser, what they've been approved by the FDA on what settings, but they were kind enough to donate those to us, so I said, okay. So anyway, so they donated 2 of us so we can use, and they're good. There's a pretty good company, and I'll have the company come out so that way, if y'all are interested in the future, they can maybe work a deal with you on these particular ones. Right? They're companies, so they always can work on a particular deal. So anyway, so this particular one actually just has chronic pain in here. If I kind of click the little red button that's on the tip, I can go to a different area. It tells me to put my glasses on. I'm just going to shine this over to the wall here.
Lightsaber.
Go a little bit into that particular area.
And that actually works, huh?
Huh?
That actually
It
works.
actually works.
Wow.
Right? And so we would have our goggles on to make sure we do that. But anyway, that's how that works. And you just put it over the area and do it for 20, 30 seconds, and then you went to the next area, 20, 30 seconds, 20, 30 seconds in that particular area.
Is that similar in frequency to like red light therapy?
Yes.
You said it was like the mitochondria. I know that's what that does.
Yes, very similar. So they'll have, and this is where it gets can get crazy. They'll have settings for infrared, red laser light, and then they'll have their laser settings. And you have to figure out which one you want to use for that. It's like, well, is it the same thing? But anyway, they have their different ways of how you can do that.
I'll split balls.
So it's one you just have to keep holding it down for it to cut off, and then it cuts off for you. This one looks like it's almost charged, so we're good there. So who wants to be a patient and doctor for low back?
I'll be low
Or we
back.
could do I can actually look at this here. So here we have, actually any area. So heel pain, neck, shoulder. Those are all pretty much the setups. Low back. So you're having some low back issues? Yep. We can do that.
Ooh, ain't.
So can we go through clothing or directly on the skin? Directly to the skin. Can you go through clothing? Yes. Still gonna penetrate over the skin's better. And why is over the skin better?
Direct contact.
Direct contact, but you can note if there's any reaction. If she has her clothing over, you could be burning her. Right? Not with this one, because it's a cold laser. So you're not gonna worry about that. This is considered still cold laser. It is at a higher level for that. So let's see how, I'm gonna have you just move your legs here. I'm gonna have you scoot down just a little bit on the table, unfortunately. A little bit more. Yeah, a little bit more. Yeah, this, our tables.
They're huge.
unpositioned too low.
She needs the cool shades, Dr. B.
Oh, yeah, me and her shades.
Bunch of haters.
Let's see.
Great friend.
I think he looks pretty cool here. Hey.
Every bus driver has one.
You're the operator.
Oh, I'm doing it? Okay, cool.
Look like Willy Wonka.
Whoa.
Okay. And now just hit the low back one. And it's all preset, you don't have to change anything. So if in our practical, if you get the low back, which will be the only case we're gonna do for this one, if you pull the laser one, it's just setting up just like this, right? And it has the pictures, so do your best that you can in that
Just line it
particular area. So you're kind of around that L4, L5 region, which is the majority where most people have problems. So you can have 3 beams of laser, and then all you're gonna do is just hit the start. And let me have it scoot down just about another inch. There you go, perfect.
Do you feel it?
So as you notice on this one here, because you all will look at this little screen, they'll have head and cerebellum. A lot of chiropractors that are within Oconia are AK doctors, applied kinesiology doctors. And so some of those doctors might be a little bit further to the sides of us. And so they'll use, well, if I can stimulate something, then why don't I just do the brain? So that's just kind of a philosophy of how they do the area. I would never put that into the brain area laser. I don't know why, it just doesn't seem that I could, but a lot of doctors do, and they get very good results from that. So as they're lasering an area, so having some shoulder pain, they'll do the shoulder, and then they'll also do some upper cervical or into the cerebellar region, and get very good results from that. Right? But that's where it gets a little philosophy. So that part is not FDA approved, cleared to that area.
That's something.
For whatever reason, certain groups gravitate. Arconia is a lot with AK. Interesting enough, standard process. A lot of AK doctors are with standard process. Right? Some great stuff within standard process, great stuff with an AK. That'll be up to you in the future to do. So if I were an AK doctor, let me get your hand here. Push up against me. And put this little vitamin on here right there. Keep facing up. Press up against me. Okay, there you're deficient. Right?
Stop.
And people get
Huh?
well from that. I can't explain to it because I'm not an AK doctor to do those types of stuff, and they'll do various muscle tests and swipes. A lot of even activator techniques
Huh?
do similar stuff with that.
I'm just saying, don't judge it till you know it.
Okay.
True.
So who has another area of concern they want to work on? Muscular, wrist to shoulder.
Shoulder.
An area,
Neck.
right? So if you want to, use this one here, doctor and patient. Put goggles on, and then when you'll do that, put this, and I'll show you how to do it. I have another one over here, 2 goggles. These are kind of cool too.
Yeah.
Oh.
I like those.
This is more of a Dorian style one, so. And then I have some alcohol wipes before you, which I did the ones y'all have on earlier, I wiped them. Why did I do that? Yeah, so wipe them down, because I don't know who used it.
Doing a great job, Rob.
Yes. So do this.
Let me tell you,
Keep going.
If you love those ones, get
I'm
right.
really doing a lot of work.
I didn't drink all three of those at once.
People will pay. People pay good money for that.
Charge someone
I'm just gonna
$75
act
for
like I'm a
this.
CJ and just like press knobs the whole
So
time.
the nice thing about these is that you can set it and walk away.
Right.
These you have to go, so if you're in busy practice, just put the patient on. So that's good with these particular ones. And you're not gonna have somebody walk out with this.
With an issue.
They can walk out. You can have a disgruntled employee.
That's
it's
true.
like, well, I'm gonna show them, I'm gonna take this $6,000
Ooh,
thing and put it in my pocket. See you,
that's
doc.
very true.
That's gonna have one of the.
So make sure you keep track of it.
Get nifty.
So that's the positive and the negatives
Of the smaller ones,
of
yeah.
these things.
Let's see,
Whoa.
$75 a visit, how many visits would you need to pay for this machine?
Everybody getting
Is that a
listed.
charge?
Everybody.
That's true.
Dorian's
We got to
buying
pay
mine.
something off.
That's bad.
I said Dorian's buying mine.
Okay.